I'm Dr. John Hosen from Bannockburn Chiropractic, and this is part 4 on my talk of sciatica. My last video I talked about or showed examples of treatments in the office. Here I want to talk about things that people can do at home that help. And what can I do? What stretch, what exercise is best for sciatica? The short answer is it depends. Every case is different. We want to move in ways that minimize symptoms out of the legs. In fact, ideally, we want the symptoms to come closer and closer towards the spine. Even if you have low back pain, getting the symptoms out of the legs is so important. And that's where we break down moves into different categories. There's nerve flossing or nerve mobilization. Here is an example of a nerve floss or nerve mobilization. This is a simple maneuver. Notice that I am moving the foot at the top like so. Here is a nerve floss for the tibial nerve. These movements may feel good. This is an example of a sciatic nerve floss in the seated position. Mobility of this area can be achieved in different ways. Some of these may be helpful or they might not. A lot of it is trial and error. Or there's simple repetitive stretch maneuvers that may be helpful as well. I like this stretch for extension of the spine. Some cases it can be very helpful. Repetitive movements like this can be helpful for disc issues. It's okay to try and move in different ways and be creative. Some people respond better to flexion maneuvers like this. Others respond to other movements. Deep squatting can be great for the spine. Whatever stage of sciatica symptoms you have, it's important to remember that movement treatment in any capacity is a good strategy. Even something as simple as walking outside 5-10 minutes a day, do that consistently, that can be great. Movement is always a good thing, of course, under the direction of your healthcare provider. Here are some examples of low threshold strengthening for the back, as well as the hips and knees. Stretching the piriformis muscle can feel great for some people. Again, movements into flexion can be helpful. If you have any questions on any of this, feel free to give our office a call today. Make an appointment and speak with one of our providers. Whatever we can do to get you doing what you love is most important.